So a real popular trend in facial plastic surgery these days is buccal fat removal. When we think of the face as it ages, there's lots of contributing factors to whether a face is full or lean. When we're young, our face is full and juicy. When we're older, our face starts to look much more skeletal. And the reason for this skeletization is there are lots of factors. One is loss of bony cortex, so we lose our bony architecture. You know, our teeth might get shorter, we might get some resorption of our mandible, our maxilla, and so the skin is now all of a sudden on less of a stretch, so it hangs or droops. Another major contributor to volume loss is loss of our fat pads in the face, and some of the big ones are the temporal fat pad, the malar fat pad, which is the cheek, the buccal fat pad, the subobicularis oculi fat pad. So these are some of the common fat pads that we think about as we watch a face age. But the buccal fat pad is one that is very trendy in plastic surgery these days. And you know, with social media, certainly people can learn about popular trends quickly. The buccal fat pad lives beneath this cheek skin or in this buccal region of the face. And it's a pad that's easily accessed through a small incision on the inside of the mouth. It's a procedure that can be done in the office. And an appropriate candidate for buccal fat reduction or removal is a full lower face. But we're a little more conservative, at least in our practice, in recommending buccal fat removal in faces that already have nice structure and architecture. A huge part of what we do in facial plastic surgery is add volume to replace all those volumetric concerns that I just mentioned when I was holding the facial skeleton. So the concern, if we're too aggressive with removal of volume in younger patients, are we going to accelerate the rate at which their faces age and the rate at which the skin doesn't have the support and it begins to sag, therefore creating new concerns and worries. So I'm a huge advocate of preserver of volume. I think the days of reductive surgery have, there's still certainly a place for it, but we have to select the right patient for that particular procedure. So in our practice, we are happy to offer buccal fat pad removal in the office setting or in the context of another surgical procedure in the operating room, but we're very selective about which patient we would offer that service for.